Many people believe that type 2 diabetes is just about sugar, or that it's down to fate, maybe something you can't avoid if it runs in the family. But that is simply not true. There are 3 things you absolutely must understand if you want to prevent type 2 diabetes, and knowing these could change not just your risk, but your whole future health. I'm Dr. Nerys Frater. I'm a GP and I'm founder of the Lifestyle Clinic, and I've spent years helping people reclaim their health, lower their blood glucose, and break free from old myths about diabetes. So if you're ready for honest, practical advice without any scare tactics or confusion, you're in the right place. So in this video, I'm going to show you the 3 things that I think you must understand if you want to prevent type 2 diabetes. And this hopefully will help you take control of your health, lower your risks, and feel confident about your future. So we'll talk about why your waist size matters more than your weight, what genetics and epigenetics really mean for you, and why insulin resistance, not just sugar, is the real driver. And of course, what you can actually do about it as well. So let's start with the first thing you need to know. Your waist size matters more than you think. Now, I do want to pause there because there's a lot of stigma and shame around weight and diabetes. And this is not about blaming anyone or making you feel guilty. But these are the patterns we see across the research, across the UK, and they're shaped by so many factors outside our individual control. So carrying extra weight around your middle, what we call central obesity, is one of the strongest predictors of type 2 diabetes. And it's not just about the number on the scales or your BMI, because you can have a normal weight overall. But if your waist is on the larger side, your risk, I'm afraid, is still higher. And this isn't just a theory, it's backed up by some of the biggest research we have in the UK. So the UK Biobank study followed over 500,000 adults from right across the country. That's more than 500,000 people, making it one of the largest studies ever done here. So what did they find? That waist size, measured right around your middle, was a strong predictor of type 2 diabetes risk, even after accounting for overall weight or BMI. So in other words, you could have a normal weight on the scales, but if your waist was above that healthy range, your risk of developing type 2 diabetes was much higher. And this pattern held true for men and women and across all backgrounds. The researchers found that people with a larger waist, so above 94 centimetres for men or 80 centimetres for women, were much more likely to go on to develop type 2 diabetes over time, regardless of their BMI. That's why it's so important to pay attention to your waist. So why does this matter? Because fat around the middle is more than just a dumping ground. It releases chemicals and hormones, and it actually drives insulin resistance, which is the real engine behind type 2 diabetes. I will talk more about that later. But this is why I pay way more attention to somebody's waist rather than what's on the scales in my clinic. So let's talk about the second thing you must understand, your genetics. Yes, family history matters, but it isn't the whole story. Now, let's get real about genetics. Do you remember the Human Genome Project? It was the biggest study of human genes ever done, involving scientists from all over the world. When it launched in the 1990s and finished mapping our DNA in 2003, there was such huge excitement. The idea was simple. If we could find all the genes that causes disease, like diabetes, we could fix them, and suddenly we'd have cures for everything. But here we are, more than 20 years later, and those simple answers never actually arrived. Why? Because we've realised that having a genetic trait is just one part of the story. What we've learned through the Human Genome Project and countless studies since then is that your genes are not your destiny. They're more like a set of switches. And what flips those switches on or off is the way we live our lives. This is called epigenetics. It means your daily choices, what you eat, how much you move, your sleep, your stress levels, they can actually influence which genes are active and which stay quiet. So yes, you might have a high risk of diabetes in your family, but that risk only becomes reality if the right or wrong switches are flipped. The latest research shows that lifestyle changes can dramatically reduce your risk, even if you have a strong family history. In fact, some of the biggest improvements are seen in people who take action early, long before their blood sugar ever tips into that danger zone. So if you've ever thought it's in my genes, there's nothing I could do, I want you to know that that's simply not true. You have way more power than you think, and every positive change you make is a way of turning those switches off in your favour. So let's bring this all together with the third thing you absolutely must understand, which is that insulin resistance is the real engine behind type 2 diabetes. Now, here's something that surprises a lot of people. Most think that type 2 diabetes just happens one day, or maybe develops over a few weeks or months. The reality is it's a slow process that unfolds quietly, often over many years, sometimes even a decade or more. So what's going on during that time? Insulin resistance is building up in the background. Your body starts to need more and more insulin just to keep blood glucose levels steady. For a while, your pancreas manages to keep up demand, and your blood glucose looks perfectly normal on tests. But beneath the surface, the strain is growing. Eventually, the system can't cope any longer, and that's when blood glucose starts to rise and a diagnosis is finally made. Unfortunately, we are seeing this happen at younger and younger ages. It used to be called adult onset diabetes, but I now commonly see people in their 30s and even in their 20s going down this path. And that's why it is really important to act early. Prevention is better than cure, even if you feel fine and even if your blood glucose is normal. Prevention is about what you do now, not waiting until there is a problem. And of course, the good news is you can turn things around at any stage. The research is quite clear on this. For example, the NHS Diabetes Prevention Programme here in the UK has shown that people who take part in simple, structured lifestyle changes, like eating better, moving more, and losing just 5 to 7% of their body weight, can cut their risk of developing type 2 diabetes by more than half, even if they already have a pre-diabetes or a strong family history. And it's not just in the UK. The Finnish Diabetes Prevention Study and the US Diabetes Prevention Programme, both massive long-term studies, found the same thing. People who made modest changes to their habits, so not a complete overhaul, saw a 58% reduction in their risk of developing type 2 diabetes. Now, that is more effective than any medication I prescribe. What's even more encouraging is that these benefits were seen across all ages, even people in their 50s, 60s and beyond. So it is never too late to make a difference. And it is the small, consistent changes that do add up. Again, the science does back it up time and time again. So remember, type 2 diabetes isn't something that just appears overnight. It's a progression that happens over years. But that means you actually have years of opportunity to take action, build healthier habits, and to change your future. And if you're looking for honest, practical support, that's exactly what I do with the Lifestyle Clinic. My approach is very much doctor-led, realistic, and focused on changes that work for real people in the real world. You don't have to do this alone. You don't have to be perfect to see progress. And if you want more step-by-step strategies, you can download my free guide, check out my free mini-series on blood sugar mastery, and they're both designed to give you practical advice that you can start using today. You'll find the links below this video. And if you're curious about your own risks of developing type 2 diabetes, Diabetes UK has a free Know Your Risk tool so you can use online. It's a great starting point, I think. But remember, the most important thing is what you do next. Thank you.